joined by whoever I just asked to unmute. I am so sorry. We're joined by Saif. He is from Canada, and he's going to tell us just kind of day in the life of a family medicine PA. So I think that's everything I have, Saif, if you want to take it away.
Absolutely. Thank you so much, McKenna. Hi, everyone. My name is Saif. Saif like sapphire or saffron, just the beginning part. I am a physician assistant and I work in family medicine in Canada. I'm really looking forward to this. I like to spread the word about PAs and answer any questions that people have. I'd like to echo what McKenna was saying about the video. During COVID and the pandemic, I've been very deprived of human connection and seeing people and faces. So if you don't have to, you absolutely don't have to, but I would prefer, and I'd feel much more comfortable seeing your wonderful faces as well, just so I'm not, on display like this. But feel free, no pressure, but I would appreciate it. But we will get started anyways. So I have a little presentation here. I don't like presentations as much as I like conversations and discussions. So feel free to ask questions throughout the entire session here. I might answer some during the talk because I might touch on some of those points anyways. If I don't answer any of them, or if I don't answer your question during the talk, then hopefully I'll answer it at the end. We'll have a full Q&A session there too, but I don't want to talk the entire time. I might ask you guys questions as well during this talk too. So feel free to put in topics or anything that you'd like me to touch on during this, just so I don't, just in case I don't get to it at the end, I can maybe touch on it during the talk. Okay, so I have a PowerPoint here. Okay, so welcome and hello from Canada. I am going to start off by talking a bit about myself. So I was born in actually Pakistan when I was born. That's the location I was. And I moved to Canada when I turned about 1. So I was raised in Canada, but I was born there. My parents are from there. My family's from there. But I was raised here. I went to school. I went to McMaster University, and I got a bachelor's degree in a Bachelor of Science in kinesiology. That was where I started. During that degree, I also joined the military and was part-time in the military as part of the Health Services Reserves, training to be a medical assistant. I did that for about 4 years, which I thoroughly enjoyed. I can talk more about that if people have questions. I also was a lifeguard during that time, and I also joined the McMaster dance team. That's another passion of mine, I'd say. After kinesiology, I then applied directly to the physician assistant program that we have here in Canada at McMaster University. There are 3 programs in Canada. The program at Toronto, University of Toronto, University of Manitoba, and the McMaster University, which is in Hamilton, Ontario, which is in Canada. And then after that, I applied to jobs, and then I started working in family medicine just in November 2020. I graduated in August 2020 during the pandemic. So that was an interesting time. I could also talk about that if people have questions. I don't want to talk too much about myself because I love talking about myself, obviously. So if you have questions, feel free to ask. I can dive into anything and talk about it for hours. So I'll try not to. Physician assistant. What is a physician assistant? So I'm assuming some of you know, maybe some of you don't, but to summarize, a physician assistant is that definition there. I'm sure you can all read. It essentially is, how I like to describe it is, I am an extension of the physician. I can order tests, order imaging, I can see patients, do physical exams, do procedures, and prescribe medications. But I'm doing all of this under the supervision of a physician. In family medicine specifically, I don't open up my own practice. I help another physician with their practice so they can see more people in a more timely manner. So that's kind of the spiel I give. I also say, so in Canada, the reason I have to say this a lot in Canada is because it's actually relatively new in Canada. Our first kind of PA class started in 2008, and we have still less than 1,000 PAs in Canada. But in America, where a lot of you are from, there's a lot more PAs. It's much more well known. So sometimes I'll say that we are similar to a nurse practitioner in terms of scope, but we just have a different schooling, a different kind of training model, and we work a little bit more closely with physicians, and we can't open our own practice. So that's kind of a quick debrief about what a physician assistant is. Okay, so the rest of this is going to be kind of some questions that I've been asked often during my career, during my journey through this profession. And so one question I get often is, why family medicine? So there's many reasons. One of them being there's just a wide variety in medicine, or a wide variety of medicine. I always knew I wanted to work in something general. I didn't want to specialize right away because I enjoyed the human body. I enjoyed learning about the physiology and what could go wrong and the amazing things that it can do and the unfortunate ways it can fail us at times. So I wanted to know everything from different dermatological conditions all the way to high blood pressure, to mental health, to rare and wonderful conditions that you don't see often, but still may brush past you during family medicine. So that's one reason. Another reason is that family medicine is one of those specialties that give you an opportunity to follow up with a patient from the day that they're born to the day that they potentially die. If you live that long, I guess. But you might be able to see someone as a baby grow up into an adult throughout your career, and you get to see all those changes, and you're able to, during follow-up, you're able to nudge them along a healthier lifestyle, a healthier path, potentially, to keep them out of hospital, to keep them from having to see a specialist by hopefully just doing enough day-to-day work to keep them on a healthy trajectory. And when you do something, when you decide to do some type of treatment, you can always come back and see them again and see if it was working, what the outcomes were, and whether or not it needs to be adjusted, which can't be done in all specialties sometimes. Like the ER or surgery, you might be able to see them and follow up once in a while, but then after that, they kind of, are released or discharged from your care. Family medicine, they aren't discharged unless they pass away or unless they choose to see a different family doctor. Another thing about family medicine is that you see a lot of healthy people. And so I didn't think I would like doing that when I first got into healthcare. I thought I even wanted to see the sick people because they had more interesting cases. But to understand what normal is, or to understand what a healthy individual is supposed to look like, or healthy blood work or healthy investigations, is so important, because once you understand that, you can build upon and recognize when it's abnormal, when something is wrong. It gives you a good framework, a good foundation to build upon. So I am interested in doing that and learning that kind of baseline information to be able to then acknowledge when something might be amiss or something might be out of the normal. Procedures. So in family medicine, there are a handful of procedures that are commonly done. Luckily, in my clinic, we actually are in a smaller town, so we actually end up doing a lot more procedures than another family medicine clinic might do. So we do, if someone needs a biopsy, an excisional or punch biopsy, then we will actually do those instead of referring them to dermatology, unless it's very complicated. We do, sometimes if a patient has a simple laceration, they can come into our clinic that same day and get it sutured in our clinic instead of having to go to the emergency hospital. Because it's a smaller town clinic, we have same day, like urgent care appointments as well. And so there's been times where I was literally suturing a laceration in a family medicine clinic, which I thought I'd never do, but that's a very unique situation. I think more rural or smaller town clinics might be able to do that, but your urban and more city-centered clinics likely wouldn't. You would likely go to an ER to get that done. But yeah, there's a lot of other procedures that you will do, you know, joint injections, incision and drainage procedures. We also will do, if they're simple enough, you know, you're doing your pap smears, you're doing other forms of biopsies. We have some doctors that's had some more training and specific specialties that allows them to do more procedures as well. So I really like hands-on procedures. So I don't think I could work in a specialty that had 0 procedures at all, because I like to fix a problem with my hands sometimes. And then the main reason I think I chose to work where I'm working now is because of the work environment and people that I work with, which I think is the most important thing for any job almost, is where you're working. Do you enjoy being there? Do you enjoy the environment? Do you enjoy the people that you have to work next to every day? Because that makes such a world of a difference. And my supervising physicians are so kind and are so helpful and encouraging of my learning. So I thoroughly appreciate them. And also the rest of the staff, the receptionists, the nurses, they're all just it feels like a family. And so when I go to work, I feel very comfortable. I don't feel like there's a lot of pressure on me or a lot of, you know, stress. So there is stress, but not because of the people, because of the job. So that's a huge reason as well. I'd like to ask everyone here. So is everyone, or I guess, so I know where you're from, but like, what are you doing and what do you want to do, I guess? So like, if you're a pre-PA student, is that what you want to do? And do you want to become a PA? Are you a PA student now? Are you a working PA? Let me know where you are in your life and if you're trying to get somewhere else from where you are now. Okay. Awesome. Undergrad, interested in becoming a PA, a pre-PA, incoming U of T PA student, currently midwife. Wow, amazing. Congratulations on your acceptance. Pre-PA student here, hoping to apply for upcoming cycle. Health science major, trying to be a PA, pre-PA, 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 looking to switch careers. Master's student, hoping to enter September 2022. Pre-PA, pre-PA, nurse working in the OR, becoming a surgical PA, working as a kin and interested in PA school. Awesome. I did kin as well, as I said. High school or working pre-PA requisites to community college dual enrollment. Very cool. Going to third year of undergrad, would love to be a PA. Pre-med, but also interested in the difference between PA and MD. That's a great question. I'll write that down to touch on. Pre-med, but interested in PA route as well. Kin major also. Gang. Just graduated, had an interview, but didn't get in. That's okay. Keep going. Yes, apply next year. You will get in. Keep the attitude, keep the motivation going. Just finished my undergraduate degree, currently working as a PTA. Hoping to get into business school next cycle. Amazing. Pre-med, undergrad public health. Nice. In the process of applying to PA school, undergrad, undecided between pre-PA and pre-med. We can talk about that. Undergraduate will be a senior in the fall. Sorry, I know I don't have to read this to everybody, but I like reading these. Paramedic, hoping to be a PA. I actually knew someone who was the same thing. They're also in the same boat, so that's awesome. Undergrad in health science and PSW. My cousin is a PSW. That's awesome. Considering PA school at the moment. All right, wonderful. So we have a lot of pre-PAs, a lot of pre-med / pre-PA, a lot of people transitioning, planning to get into PA. That's a good plan. It's a solid plan. Love that. Good. Well, great. PA, and what do I have next? What are your current responsibilities? Okay. Yeah, so let's talk about this, and then I could probably talk a little bit about PA versus MD in this. Because I think I'm hoping to give you an image of what a PA does in family medicine. Yeah, because the role of a PA is different in each specialty, and what you do, how much you do, differs in each specialty as well. So we can talk a bit about that. Thank you for replying, everyone. That was a lot more answers than I thought I'd get. So that was great. I feel like I'm talking to people again. It's wonderful. Okay, so in my clinic, the things that I do are I will do a full patient visit. Full patient visit means I go in by myself, I take the history, do a physical exam if necessary. I can order investigations if I feel that I am confident in what I'm doing. I can prescribe a medication, and I can start a treatment, or I can do a treatment if I think it's appropriate. A lot of the time before I do some of these things, just because I'm still relatively new, I'm only about 8 months in, I will review with the physician or double check with them that they agree with what I'm doing. Another thing that I will do is in family medicine, one of the key things is that as you order tests, labs, imaging, whatever it is, you have to act on that. So you could order a test, 2 weeks ago, and then the patient gets it done, and then you have to go back and see the chart and then handle it. So the labs come in, and you have to either act on them if they're abnormal, or you have to, book an appointment so you can talk with the labs, with the patient, whatever it is. So I help the physicians by taking on some of that workload and reviewing those labs and imaging, and then sometimes acting on them if I think they needed to be acted on, and if I think I'm competent and confident enough to do that. Procedures, like I said before, these are some of the procedures that I do in the clinic. The list goes on, but those are some of them. And then preventative care, I will, call patients up to let them know that they're due for their mammogram, pap smear, or for their colon cancer screening test, and talk about that, explain that to them, and just make sure that we're still doing that part, because that's what family medicine should be mostly about, is preventative care, preventing patients from getting to a point where they're very sick and have to be seen in hospital. And then referrals, if the patient needs to be referred, then I will make that referral myself. I'll write the referral note, I'll send it off on the behalf of the physician that I'm working with. And then if the referral note, if that physician specialist sees the patient and sends a consult note back, then I can review it and implement the plan that they recommend, or follow up on the patient appropriately. Okay, so just talk about PA versus MD. So in family medicine specifically, in family medicine specifically, the difference between a physician and a physician assistant is that the physician, it's their practice. It's not my practice, it's their practice, and I'm helping them with their practice. So at the end of the day, all of those patients are still that physician's patients, but some of these patients I will see repeatedly. So I will become their main touch point. So whenever they come back, if it's for the same problem, they might see me every time. And I have patients like that now that I'm following up with consistently, and I'll always book them back on the day that I'm working with that physician. And so I can see them continuously. Another thing is that, as a physician, I work with 4 different doctors. I work with a different one every day. And so luckily they have each other to talk to if they're unsure about something. So if physician A is not sure about this case, they can go to physician B and ask, hey, what would you do for this? I have that all the time. I can always go to my physician and say, yeah, I'm not sure. I've never seen this before. What do you think? But if you were working alone, then you might not have someone in the room. You are the highest kind of authority in that room or in that clinic. So you could either, ask your friends online or physician colleagues, or, certain chat groups and stuff. But if you don't have people around you, then you're kind of, people look to you for the answer. Procedure wise, I can't do a procedure unless my physician also can do that procedure. So if I know how to do something and they don't, I can't do it, because they have to be theoretically able to do the same thing that I'm doing. In case things go wrong, they can take over. I can learn many different procedures, but I can't just like teach the physician how to do something that I learned in school or I learned from a specialist at some point. But I can always add to my repertoire. If they have a list of procedures that they do, they can slowly teach me, and I can eventually do some of those procedures with enough practice. They have a lot more messages and labs than I do, because they are the patient's physician. So a lot of it gets filtered to them, and then I might handle any overload. So that's kind of the main differences there, PA versus MD in family medicine. In each specialty, it's different. So if you have a specific specialty that you're interested in, then actually, yeah. So anyone who's interested, I guess everyone can answer, but anyone who's thinking of PA versus MD, comment what specialty you would be interested in, or if there's multiple of them, you can comment that. And I can try to touch on what I think the difference between PA and MD is. Schooling wise, I'm sure you guys are maybe aware of what the difference is, but PAs in Canada have a 2-year program. In the US, I think it's 2 to 3 years. I think sometimes American PAs also have a PA residency at times. Whereas for med school, it's usually 3 to 4 years of schooling, and then however many years of residency, at least 2 up to infinite, I guess. Could be forever if you want it to be. But okay, so, oh, wow. Everyone, great. Okay, so pediatrics, gynecology, internal medicine. Okay, I'll try to touch on these. Again, I'm gonna try to stay within the time, but I ramble, as you guys can tell. So pediatrics. Pediatrics, internal medicine, a lot of the hospital specialties, or I guess pediatrics, these aren't specifically hospital, but usually you're seeing a specialist. The PA will do similar things that the physician will do in all of these specialties. If it's like an internal medicine or like a specialty that involves holistic care, that isn't procedure driven, it's all pretty similar. So consults, a PA can do a consult on their own, do a full consult, and then review with the physician after. Whereas a physician is not reviewing with anybody, they're just doing the consult. A PA can still create a plan, a PA can implement a plan, and a PA can follow through and follow up on a plan. Physician can do the same thing, but usually, again, the PA is doing this in conjunction or together with the physician. But if it comes to any procedures, I don't know if I saw surgery. I saw some surgery, orthopedic, trauma. So when it comes to anything that's surgical, a physician assistant will not ever lead a surgery on their own. The patient has to be, under general anesthesia and you're doing a full surgery, a physician assistant, no matter how many times they've seen it, they can't do that on their own because they don't have that formal training. As far as I know, I don't know about America, how wide that spectrum goes, but as far as I know, the physician always has to be the lead and the PA can be first assist. Regardless of which surgery you're doing, orthopedics, gen surge, surgical oncology, all of these types of things. With that said, a lot of the times PAs, when they're working in a surgical specialty, they're often actually more so working in the ward, or they're more so doing consult and follow-up. They're not as often in the OR, especially in teaching hospitals, because a lot of residents are coming through, medical students, PA students are coming through, and they need that time. whereas a PA may be more efficient or more effective to be in the wards taking care of the patients on the floor, taking care of patients who just had surgery or who are about to have surgery, and maintaining that. And that frees up the physician's time to go do the surgeries that they have to do anyways, or do really complicated consults or meetings or whatever they're doing. So that ends up being more the case in surgical specialties. Every other kind of internal medicine or type of specific specialty, it's, you can do the consult, you can do the follow-up. It's just you are always reviewing as a PA. Dermatology, yeah, same thing. Emerge. So Emerge is kind of like family medicine, where you go in, you do the entire visit on your own. You come out, you review with the physician maybe really quickly and say, hey, this is what they came in with. This is what I think is going on. I think I want to do this, this, and this. And the physician will be like, all right, sounds good, go ahead. Or they'll say, yeah, it sounds good, add this one extra thing on just to be safe, or like, oh, maybe try this instead. And then the physician assistant will carry out that plan to completion. The physician will usually have to come in and say, hi, I agree with the plan, good luck. And then the PA will do the suture. So they'll reduce the fracture, which means to put the fracture back in place, put a cast on, to stitch someone up, to admit them, to order medications, whatever it is. I hope that answers that kind of dichotomy between PA and MD a little bit. Yeah, if you have any specific questions about that, then let me know. Okay, McKenna, are you're still taking note of like the other questions, I'm assuming? Okay, cool. I'll get to the other ones at the end, I think, or at some point. Okay, so back to this. How is your relationship with MDs and their staff I work with? The short answer to that is it's wonderful. It's great. I really enjoy it. I prioritize it. That's the main. I actually didn't think I wanted to go into family medicine when I first started PA school, and even during clerkship, I was thinking more hospital specialty. But when I interviewed for this position, I met the physicians and saw the clinic and how nice looking the clinic looked. I kind of was sold, and they just seemed that they were all kind of starting their own practices, relatively new. They're all, either with 2-3 years starting their practice, or taking over somebody else's practice or something. So I felt very much at the ground level. I was their first PA as well, so I could establish my role how I wanted to. And so we have built a great relationship, and I enjoy working with all of them. It's a good time. So I encourage everyone to, whatever you do in the future, make sure you actually enjoy the people and the environment that you work in. I will say that 100 times, I think. So, yeah. Are patients generally open to the idea to be seen by a PA? Oh, so these are some extra questions. Yes, patients are generally open. So like I was saying before, in America might be different. In Canada, we aren't very well known. So I have to explain my role definitely every day, multiple times a day. And there has been, I can count on one hand how many times a patient said, I don't want to see you, I want to see the physician. Very rarely. And the times that they do say that, I will usually say, well, can I talk to you first? And if there's any questions left over or things that we're not sure about, then then I'll ask the physician to give you a call or to come in after as well. And they usually are okay with that. We go through the whole visit, and 8 or 9 times out of 10, they are happy with the visit and don't need to see the doctor after. So I think in Canada, because we don't have that automatic recognition, we have to build the trust and respect. Not respect, but the trust and recognition through what we do. So every day I'm trying to prove myself to patients to show that I'm competent, that I'm empathetic, that I am there to listen to them. So it's a constant thought in the back of my head that I'm selling myself, I'm selling the profession to them every day. But for the most part, people are are okay to see us. They're okay to see somebody as long as they feel listened to. What are some strategies that you use to build rapport and trust with returning patients? It's just listening. It's just being, some people just need to be heard. Like that's all they really care about, even if they're frustrated, even if they're having a hard time. As long as you just take the time to really listen, ask questions about what they're saying, and then provide empathy and words of kindness if they need it, and then give them high quality care. Like if you take care of their problem, or at least help them in the right direction, then they'll be grateful and want to see you again. Okay, I wanted to talk about my typical day. I don't know if I have a slide in here about that, but my typical day, the clinic starts at 9 a.m. I usually try to get into work 8:45, 8:50. I go into the physician's office that I'm working with that day. So every Monday I work with a different physician. Every Tuesday it's a different one. But it's a consistent schedule. So I'll go in, we'll review the day of what we have, what patients we have, and we'll divide up the patients. So I'll be seeing half, sometimes more, sometimes less of the patients that day, and then we'll section it off, and then I'll go off and go do all my visits. If they're over the phone, then I'll just do them in my own. I am lucky enough to have my own office, so I have my own phone and computer, and I will use that to do phone appointments. And if it's in office, then I'll go into their patient rooms and into the clinic rooms and do the in-office appointment. We usually review at lunchtime, which is at 12. We will review the morning, what I did, what I thought about all the patients, and what my plan was, and then they'll just sign off on my plan. And change it if needed, or add something, or call back a patient if we need to, things like that. And then I'll clean up my notes for the morning, and then I'll have lunch. Then at 1 o'clock to 5 o'clock, we have the rest of the day of seeing patients as well. Same kind of deal. At my clinic, we have same day appointments or urgent appointments. So patients can call that day and say, I have a thing that needs to be seen today. And then they can come in or be called on the phone to talk about that. And we have about like an hour and a half in the morning, an hour and a half in the afternoon of those same day urgent appointments. That's Monday to Thursday. And then on Friday is the on-call day for our clinic. So I come into the clinic from 9 to 12. I review labs and imaging and other consult notes and stuff that are coming in, the inbox of the physicians, and I try to clear out some of that, or at least handle anything that's urgent that needs to be handled that day. Like if someone is on warfarin and they need their INR checked, which just means just to see that their dose is stable and they don't have to change it today or tomorrow. So things like that, or if there's a fracture or an infection that's been shown on a urine analysis or something like that, then I'll act on those things. And then lunch, and then 1 to 5, like today, we will see patients, same day appointments again. So people will call in, I have a problem, they come to the office and are seen that same day. Today we had a lot of different types of patients. We saw someone with we saw a couple rashes. We saw Lyme disease today. I haven't seen Lyme disease before, so I saw Lyme disease today, which was really interesting. And there was a patient who had like a neoplasm, like a potential tumor on an X-ray that we had to inform them about. And we had, what else? Someone with a kind of a vaccine reaction. They had a vaccine, and we're not sure if it's actually related to the vaccine, but they kind of developed like a lump or like a bump on their arm that wasn't related. I don't know, it's complicated, but we saw a lot of interesting things today. So, but that's the typical day for me, or typical week. I don't work weekends, thankfully, but I do pick up shifts actually at the local vaccine clinic, and I go and give vaccines as well. As a PA, like we have that ability to work in multiple roles. So I do vaccine clinics. I also do COVID screening for this kind of organization that sends people to specific areas in our country to go help with mining and whatnot. And so we have to do this specific COVID screening, and I do that once or twice a week as well. And that's another part-time job that I have. That's kind of my schedule, my typical day. Rewarding moments in my career, positive feedback. I love hearing. I think my favorite compliments are from patients when they say, "Oh, he's a good one. He's a good one," or something like that. You know, the older patients say, "Oh, you better give him a raise or something," and that's, you know, what keeps me going is when patients acknowledge, or when patients show appreciation for what we do. I think any service industry or any healthcare job is often thankless, or can be, but I'm lucky enough in family medicine. I do think I get thanked enough to, you know, keep me going, I guess. Like, I know we don't do it for the recognition, but it really helps when people recognize that that we are trying to, you know, that we are working for them. And so hearing compliments from them, and it's usually not, "Oh, you really figured out the diagnosis," or, "Oh, wow, you really did an amazing, you know, history, like a physical exam or something." It's more so like they did a great job at listening, or just relating to me, or just being present. So those are the skills that I think are really important and hard to replace. And then, yeah, getting compliments from, or getting positive feedback from the physicians that I'm working with, and the other nurses and staff and whatnot, are rewards on their own. I was lucky enough to work in a clinic where they had an extra room, and I got to put together in my own office. I've been slowly adding to it. This is an older picture. It has a floor now, and it has a desk and a window with blinds. I should have updated this picture, but it doesn't look like this anymore. It looks much nicer. I have a picture somewhere. I'm sorry. It's a nice office, I promise you. And I'm very, very grateful to have it, to have my own space where I can hang my degrees. I can, you know, have my own area where I can just sit and relax and, you know, have some headspace to myself. It's really wonderful. And again, I'm very thankful that they gave that to me. I don't think it's very common to have your own office, depending on where you work. I mean, most people don't have offices if they're working in a hospital. You're kind of just working in different, you know, pods and sections and whatnot. But so that was a reward. Procedures, I always like to do a procedure because there is a beginning and an end, and there's always usually some type of result from that, whether you do a successful PAP and you find the cervix, or if you suture up a laceration, or if you get the needle into the joint without a hitch. All of these things are, you know, cause and effect, effort and reward, kind of really tightly connected, which is nice. And making a difference. Well, this is why we're all here, to make a difference in people's lives. Why do you want to be in healthcare? Because I want to help people. I want to make a difference. We're all here for the same reason, and it's a beautiful reason. And don't let anyone tell you otherwise. It's not a bad reason. It's rewarding on its own to just make someone's life better, even if it's just by a little bit. So, yeah, I have seen that my care, or my decisions in care, or my whatever it was, has made a difference in people's lives, and they are happy to come back and talk to us again. Or they, you know, we start a medication for someone who's going through depression, and they come back to us and say, "Oh, my whole world is different now. Like, I'm so much better." And those things are just, again, little pieces of reward that you really hold on to, because it is a hard profession, especially during these trying and wonderfully difficult times of COVID, to hold on to small things like that, small wins. So, yeah. And speaking of that, challenges and pitfalls. I'm early on in my career, so I still have a lot of stuff that I don't know. I feel dumb on a lot of days where I'm like, I have no idea what that was. And But now, I talk to the physician, they say, oh, I think it's this, you should look into this. And now I have added that to my repertoire, added that to my clinical knowledge. But there are days where I'm like, oh my God, how did I not know that? Like, I have so much more to learn. I'm dumb. And that will happen in every career all the time, at whatever stage you are at. Usually earlier on, it happens more, but that's normal. And all the feedback that I get is people are like, my physicians are happy with my progress. They're happy with my knowledge, but I'm very hard on myself. And I'm like, oh, how do I not know this? So I've learned to be more easy on myself, be okay with my gaps, and know that gaps are there to be filled, and I'm slowly filling them with time. And as a PA, we only have 2 years of school, so it's not a lot of schooling that we have. Like we are born, we are not born, sorry, we are released into the world with lots of gaps, but they give us the foundation to build upon, and then the tools to fill those gaps in. So I think my program taught me how to learn, and that was the point of it, not to teach me everything, but teach me how to learn on the job. And that's what I do, and I love it. So, and knowing your limitations. So as PAs, like I said, there are limitations that PAs have. There is a scope of practice that you have to work within. So there's that aspect, but there's also the aspect of when you're not sure of something, to not be like, I think it's this, so I'm just going to do this. I have to, or we all have to, or any PA or any clinician has to know when they are beyond their limits of knowledge and when they should ask for help or step back and say, well, okay, I'm not going to make this decision if I'm not 100% sure. Let me double check, because there's cowboys and cowgirls, I guess, out there who will go and do everything that they think that they should be doing. Like that's a horrible way to put it. What I'm saying is they are overconfident in their knowledge or in their ability to understand, ability to accurately diagnose and accurately treat sometimes. Because like I said, we have gaps. And if you aren't aware of your gaps or aren't aware of your limitations, then you could cause harm to a patient. It's important to not do that, because we all have imposter syndrome too, still there, still happens, where you feel like, how can I don't want to feel dumb, so I'm going to decide that this is probably the right thing to do, and I'm going to do it. But that could cause harm. So it's better to just say, you know what, maybe I don't know what I'm doing. I'm going to step back and make sure that I'm not doing the wrong thing. But not me. I think I'm realizing this as I'm becoming an adult, is that I'm working 9 to 5. I work 9 to 5 Monday to Friday. I've never done this like this before. I've been in school, I've worked part-time jobs, I've worked full-time in the summer, but this is like 9 to 5 Monday to Friday. And getting used to that, getting used to a schedule every day, and then also knowing that this is my future, like this is what my life is going to be like, is a very interesting realization that I'm trying to come to grips with, because I had so many other things that I still have them, and I still will do them, but now I have to try to plan how I want to do all of these things. So I don't think the job is monotonous. I think the routine of waking up, same time, going to work, coming back, I do the same things every day, and it's kind of, it's nice, but also, I don't know, that I have a part of my soul that wants to just fly in a plane to somewhere and live on the streets. I don't know. Difficult patients, everyone has a bad day, or they have a bad week or a bad month or bad several years. So sometimes they aren't happy with you, or they aren't happy with the world, and they'll let you know. And so they will take that out on you sometimes, no matter what you do or no matter what you say. And us working in the service industry, most jobs are in the service industry, whether you're a barista, whether you're a paramedic, a physician assistant, you're a lawyer, people can get mad at you for you doing your job. And that's something that we have to be aware of. When it comes to health, some people are they have a lot of, some people will just leave it up to us and say, well, you guys tell me what to do, I'm going to listen to you. Where some other people are say, well, no, like I know I've done my own research, and this is actually the best thing. You guys are wrong. You're just doing the wrong thing. And especially with COVID, that's been very difficult because some people have differing opinions, and we have to battle with that, or not battle with it, but we have to manage that. And so some days you have difficult patients that really drain you, that you talk to for half an hour and get nowhere with, and that, you know, you're trying to be nice, you're just overflowing with kindness and trying to, you know, not make them upset, but they still get upset. And then you have to keep going, you have to see the next patient. And so that's difficult. So it's important to take care of yourself. And I try to do that, to center myself, take a break, you know, clear my mind, know that I'm doing my best, and think back to all the wins that I have of people saying positive things and getting positive feedback, because it can pile up. So this is more about me, you know, who cares about me? What are some hobbies that, yeah, that's fine. Anything is possible. I don't even know. This is an older presentation. I don't know what this is, but this is me. Advice. This is some general advice to finish off, and then we can just do questions. What are some things that I learned that PA school could not teach about anything? I learned that who you work with matters a lot. Like I said, I'll say it 100 times. To me, at least, it matters a lot. To you, might not. To you, actually, maybe it's just a specialty that matters, or it's just the location, or it's just one specific thing. To me, this is what mattered the most, is who I was around. I applied for multiple jobs. I had some job offers with other physicians who I didn't feel a great connection with. I didn't foresee us becoming best buddies or anything like that. So I felt, to me, that was important, that because relationships and friendships and rapport and conversations are important to me. So I needed that. So I chose what mattered to me and prioritized it. You have to do the same as well. Figure out what you value and prioritize it in all aspects of your life. Know your worth, know your priorities. Wow, I'm a genius. That's what I just said. Yeah, know your worth, though. That's also important. Don't settle, and know that you have something to offer, and you should be compensated appropriately for it, but you should also be treated fairly and with respect, and with the proper recognition and care. Eventually, you can just Google it. Yeah, right? I mean, of course, everyone Googles things. The physicians that I work with, if they're not sure, they Google too. So you can never know everything. No matter what specialty you're in, you'll always be learning. You can never know everything. And like Google is literally always right there. And so I Google every day. Google appropriately, Google responsibly, of course. Don't click on, untrustworthy links. Find the links that you use. I use UpToDate is my favorite medical resource. And as well as I use the Canadian Family Practice Journal. I also use the American AAFP, American Academy of Family Physicians website, because that's free and it's very comprehensive. So I use that all the time, and I make my own notes, and I have my own algorithms and everything. So yeah, you're not writing a test. Once you enter the real life, you are now taking care of people, and you actually can use your resources that are at your disposal. Sure. Okay. Questions. It's enough from me. Okay. I don't know if you have a list of questions, McKenna, or if I should read, or whatever you like.
I have a list of the ones that kind of got overtaken by all the other answers, so I can go through those. If you just want to do that way you're not trying to scroll and see them. Sure. The first one, pretty simple. It said, if you order a test with a patient, do the results go directly to you, or do they go to the physician?
That's a good question. They go directly to the physician, but if the physician sees that I had ordered the test, then they will forward it to me. So I have my own inbox that I also manage. And so if they see that, yeah, that I've been following this patient or I saw this patient last, they will forward the results of that lab or image to me so then I can act upon it.
Okay, gotcha. This one was actually asked twice. They asked, have you had, or what was your first procedure that you did?
In my life, like in my all my so sure, I guess I can just choose however I want to answer it. The first one that I did in PA school in general was, I think, a laceration. And in first year, I was doing we do like half day placements in specialties that we enjoy, and I did one with a physician assistant that works in Toronto, and he's one of my idols, and I really respect him and learned a lot from him. But he's the first person to show me how to suture someone, and I did it on a real person, like on their hand. The person had cut their hand on glass as they were throwing out trash, and he was very cool about it. Like it was my first time, and he was like, yeah, everyone's got to learn. And he just put his hand there, and I was shaking and suturing, and it was terrifying, but it came out decent. So that was my first procedure, and I was sweaty, just so damp everywhere. But it was amazing, and I will always remember that.
One of the other questions, it just asked if you were practicing in Hamilton right now.
No, I'm not practicing in Hamilton. So McMaster University is in Hamilton, and that's where I live. I guess I'm telling people where I live now, but not where I live, where I grew up in Hamilton. Yeah, that's that's where I grew up. That's fine for you to know. But I don't live there now, and I don't work there now. I work in a smaller town, and I live in a different city. Maybe I won't reveal that. I don't know. I live in Ontario.
Completely fine.
Okay, thank you. Yeah.
I assume they were asking if you practiced where you went to school, like around the same area.
Yes. Yeah. No, I don't. I interviewed in places, and I would have been happy to still practice there, but this job just was, I don't know. Like I said, I was drawn towards it, so I ended up moving away from home, and now I live away from home.
Somebody, and I know some people are uncomfortable talking about this, but they asked what the typical salary was there, how much the starting PA pay was, and does your salary increase every year, or is there like a cutoff for PAs where you work?
Yeah, so it's dependent. It's very dependent on the specialty. So in Canada, again, because it's a new profession, we have had to justify our salaries to physicians, because physicians are the ones who are paying our salaries, or it's the hospital. So in hospitals, they usually have a pay scale that you'll enter at a certain salary, and then every year it will go up a certain percent, and it's already pre-decided for you, usually in most large hospitals. In clinics and private practices, that's more customizable, I guess. So typical salary for PAs now that are in Canada would be a starting salary, I think right now on average is around 85,000 per year, I believe. It's lower in Canada than it is in America, I'm pretty sure. But we're getting there. We'll catch up. Don't you worry. But it's about 85, I believe. It can go up from there. I know PAs who are making 120,000, but they are working in a specialty, and they've been working there for several years. So it can go. Many PAs are making over 100K, but that's because they've put in their time, and that they are working. And Emerge is a good paying specialty. Ortho is, surgical specialties, like, and then very like subspecialties as well, right? It's all dependent. And if you work, like extra, if you work bonus, if you work part-time in another job, things like that, it can go up. And salaries, yeah, I mean, depend, like I said, there could be a pay scale that you follow for your hospital, or you negotiate a raise every year with your supervising physician. And so in a few months, I will be doing that. hopefully that goes well. I'm going to ask for $2 million. Let's see how it goes.
Good luck with that.
Thank you. Thank you. I won't need it, but thank you.
Somebody asked, would you ever consider working as a travel PA?
Oh, yes, I absolutely would. That would be wonderful. And I need to look more into it because I think that's one of my passions is traveling. It's a recent passion within the last few years I've developed that, but I would love to do that. Yes, is the short answer. I will talk way too much about it. So yes, I would be interested. I don't know enough about it to dive into it. I want to, first and foremost, I want to get good at my job now. In family medicine, I don't want to, jump ship. I want to get good at this job and to the point where I'm like, okay, I'm super confident and I could teach someone how to do this. And I don't have questions every day to the doctor. I have several days where I don't have to even question what I'm doing. I'm very sure about it. Well, you should still question it, but I'm like, confident in that. And I feel like I've learned, you can never learn 100%, but at least like the majority of that specialty of family medicine. So I want to get to that point. And if I get to that point and I'm wanting to move on to other things, then I will move on to other things. But I could, for all we know, work in family medicine forever. But as a PA, the beautiful thing about it is that we can switch specialties. That's another thing I forgot to bring up about PA versus MD is that we can switch specialties without going back to school for residency. And that's huge. I mean, in Canada, I think it's the same in the US. I know in the US, they do have some PA school residencies, but I don't know if it's required or not. But I could, go work in Emerge. I could go work in surgery. I could go work in internal medicine if I wanted to. I could work in all the specialties. I could see what people are like in family medicine, and then what happens when they go to Emerge, and then what happens when they get admitted to go upstairs to internal medicine, and what happens when they go downstairs to the OR. Like I could work in all those specialties and see where people go throughout their healthcare course, and then travel PA. Yeah, like I think there is an organization called Physician Assistants in Global Health. I don't know if they do like just clinical rotations or if they do actual like jobs. So that's something I wanted to look into. And there are other organizations as well, I think, that do that. So it's something that I will consider. I mean, right now the world is still a little bit, we're still getting our legs underneath us in terms of traveling and everything, but I'm keeping that option open in the future for sure.
Awesome. So that answered a couple of the questions about what you're interested in and the switching specialties. One question asked, how do you deal with patients who think they know more about what's going on or they refuse to listen? Would you refer them to the physician then, or how do you go about dealing with that?
It's very dependent. So specifically, if a patient thinks that they know more, well, I mean, it depends, right? Like the patient knows more about themselves than we do. Like that's true. Like what they're going through, what they're experiencing, like they know more about that than we do. We can ask questions, we can try to, but it's inferring, but we aren't experiencing the pain that they are. We aren't experiencing the symptoms that they are. So they do know more in certain aspects. When it comes to medicine, usually we know more than they do. And in those instances, the best thing you can do is listen intensely and empathetically and say, yeah, like, that could be something, as long as it's not outlandish, like you could say, yeah, that's a potential explanation for this, or that's a potential treatment option. If it's not harmful, a lot of the time we'll say, if it helps, then it helps. If it's a supplement that they bring up or a homeopathic thing that I don't know about, and they find that it's helpful and I know, or I'm relatively confident it won't harm them, I'm like, sure, go ahead. Like if that helps you, then do that. But this is my advice. Our job is to tell you what our advice is. It's your decision of what you want to do. I can't make you do anything. I will say that these are the guidelines that we have. This is what we've learned for medical training. And it's our job to tell you those things. It's not our job to make you do them. So we are here to be a source of information. And most people respond to that pretty well. Some people say, no, I'm going to send you some articles that you should read, and COVID isn't real, and hydroxychloroquine is the way. And I'm like, okay, I mean, yeah, send the articles. Like, I'll give them a read. Like, I don't mind. But I'm telling you now that we can't prescribe that medication for you. Like, that's against our practice. It's against our tenets of healthcare. Non-maleficence. First, do no harm. Like, we can't do things that we will cause harm. In the beneficence, we have to do what we think is the most good. And yeah. Some patients are very challenging, and like in terms of they'll challenge you on stuff like, oh, how do you know this? Why is it this? Why is it that? Are you sure? And you have to be honest. You say, you know what, I'm not 100% sure. It might not be. Like, there's not often times where I'm like, I'm 100% sure of this and this and this. I'm like, it could be, but likely not. There's a possibility. There's possibility, and then there's probability. Is it possible? Yeah. Is it probable? No. And that's usually how I frame it.
Very awesome. Somebody asked, when you were applying / interviewing for jobs, how did you advocate for yourself and your abilities as a new
PA? So I made sure that I thought back throughout my entire clerkship and my entire kind of experience in PA school, and I gathered information and I gathered experiences that I could use during interviews. I also went back into like my undergraduate degree, kinesiology. I went back into like my time in the military, and try to gather examples of things to brag about, essentially. Like, how could I bring these things into my answers to bolster my my application and make me more suitable or make me the best candidate? So that's one thing, is reflecting, essentially, is an easy way to put it. I reflected on my life and my experiences and how I could use those. I think when, as a PA, a lot of the physicians aren't looking to see how smart you are, because they know you've only done 2 years of school. They don't need someone who knows everything. They need someone who they can work with and that they will enjoy working with, because they have to work with you. It's not like they just disappear and you're by yourself. Like, they have to be there with you. So I made sure to focus on presenting myself as who I am, like genuinely who I am, and be personable, be good at communicating. Like, if you can answer an interview question well, that usually means that you can communicate thoughts and ideas well. And that's very important in medicine, to be able to communicate something. If you know it, but you can't communicate it, then there's no point in knowing it. So I made sure that I, practiced giving answers, practiced being comfortable, not being robotic. Same thing with like, application, like applying to PA school. It's very similar to that. So there's that. I made sure I researched the position. I researched what they're looking for, how I could help them. And then I made sure that I was thinking of examples of that specialty that I was in, like why I did well in it and why I, think I would be the best candidate for it. And then, some of the positions had, some of my interviews had in-person interviews. So one was over the phone or Zoom, and then I would go in person. And some of them would have me like be part of their clinic for a day. They said, okay, I want you to see some patients and see how that goes. And I was, again, sweating buckets, incredibly nervous, but you fall back on your, oh, am I frozen? Oh no, what's going on?
You're not frozen on my end.
Okay, I'm good now. Yeah, you fall back on what you've learned. Taking a history and physical exam becomes second nature when you've done it thousands and thousands of times. So if you can do that really well, then half the battle's done. And if you can take a good history and a good physical exam, then that's the majority of the job. So I just made sure that I was really good at that too. I hope that answers that question.
Yeah, I think it does, and I think that's all good advice. Are you okay with doing 1 or 2 more questions, and then?
Oh, I could go forever. Whatever people are comfortable with.
Okay, I just know some people had messaged about having to leave around right on the hour, so.
For sure. Yeah, please do. I take no offense if you have to leave. If you have to leave, you can absolutely leave. If you want to stay, talk until tomorrow. So.
Yes, before I read the last two, I'm going to go ahead and post the Google form link so that if you do have to leave, you will still be able to get your shadowing certificate. So that is the link I just sent in the chat. So somebody asked when you wait. You don't have to answer this because it pertains to your location, but they said when you're looking for jobs, were they mainly in Toronto? Also, were there many in Hamilton?
I thought you would say, like, what is your address, your social security number, your phone number, your mother's maiden name? So the jobs, I applied to jobs in Toronto and into Hamilton and in other smaller towns as well. There were a lot of jobs in those main cities like Toronto, Hamilton, Mississauga, Brampton, like the GTA area. I'm sorry for those who don't live in Canada or Ontario. This is not familiar with you, but Toronto, you guys have everyone's heard of Toronto, where Drake is from. In that general area is where a lot of the jobs are focused or concentrated because there's so many people there and there's so many hospitals, so many clinics. So there's a lot of jobs there. I have a lot of friends who are working in those in Toronto, but there's a lot of jobs now opening up in smaller clinics and smaller hospitals because more and more people are hearing about PAs, and a PA would be so helpful and pivotal in those smaller hospitals and clinics because it's a fraction of the price of a physician, but doing a lot of the work that a physician would do. And so it makes a lot of sense, and I think it's catching on. And so I interviewed in a few different places. In Canada, we have something called the Career Start Grant, where like a whole long list of jobs comes out for new graduates to apply to. I accepted my offer to this job before that even came out. So I didn't do that many interviews. I just thought I couldn't give up the chance to work where I'm working now. So I didn't even get to that point. But a lot of my friends did tons and tons of interviews at many different locations. Some up north where it's more up, and again, more rurally, some very city center. There was more jobs than there were PAs graduating this year. I think there was like over 90 jobs or something like that. And about 50 PAs graduated in Ontario. So lots of opportunity in different locations and different specialties. And they're still coming out. It's like every day we see new jobs popping up.
Awesome. Somebody asked, does Canada have CASPA or is it a US thing only?
It's a US thing only.
Okay.
So sorry about that. We don't, but we have, actually, I'm not even sure what 100% what CASPA is. We have a PANTS equivalent. I know you guys have PANTS. We have a PACC, which is Physician Assistant Canadian Certification Council exam. But you guys have the Physician Assistant National Certification exam. So we have that, where you have to write that and pass that to work as a certified PA. We don't have CASPA. I think CASPA is to enter PA school, right?
I think CASPA, okay, yeah. So it's basically the common app for PA programs. I don't know if you know what that is. It's like a like an application service thing.
Oh, okay.
It's like, if it's like the common app, I would describe it as you basically fill out one application for PA school, and then you don't have to fill out multiple ones for schools.
Oh, okay. Yeah, we don't have that. We have individual applications. We only have 3 schools, so it makes more sense. You guys have way more than we do. So each school has their own application, their own requirements, their own prereqs and everything. So.
Yeah. Okay, gotcha. And then the last question I saw, it says, how would you go around being just a surgical PA? So I'm assuming, how would you go about doing surgery as a PA? I'm not sure. If you ask that question and you want to clarify, please feel free to do so.
Yeah. And if anyone else has, like, if you want to, you can ask, like, you can unmute yourself and also ask questions, or if you want to talk about something, feel free to. I'm, again, craving conversation and social interaction. So
So I had a question I got skipped over, but
oh,
what classes for a high schooler would you or college student would you recommend that doesn't have to be necessarily prereqs, because I have most of my prereqs out of the way?
did you say what, high school classes or what college classes?
Both.
Both. Okay. So I would say in general, anything related to the human body is a good option. So in high school, biology, nutrition, kinesiology, or like sports, like every high school has maybe different classes, but anything that's related to the human body in general, for high school and for college. So in college or university, whatever you want to call it, I did kinesiology, which was all about the human body, more about muscles and movement, but also about biomechanics and neuromuscular motor control, things like that. The school that I went to was very science focused, so it's more about that than it was about sports. So I would say, yeah, anything that you can, if you want to go into biology, that's great. If you want to go into psychology is still about the human body or human mind, I guess. So, but we had a student in my class, or like one of my friends, he's a peer, I guess. He did his undergrad in psychology and then he went to PA school. I had a friend, this is random. One of my peers did her MBA, which is Masters of Business. Like she was fully in business, and then she switched to PA. So like, that's a bad example, so don't listen to that at all. But it's because our school or this program that I went to didn't have prereqs, so you could have came from anywhere. But yeah, nursing is a great one. I think a part of me wishes I went into nursing. In Canada, I don't know how it is in the US, but in Canada, if you go to nursing during your undergrad and you graduate, you can start working as a nurse. Like if you go to college or university for it, you can work as a registered nurse. And that's a pretty amazing job to come out of university with. Most other degrees, you don't get a job out of it. Kinesiology, well, you can work as an RKin. But like biology, like what are you going to do with biology, or chemistry? Like you can work in research or get a master's or something. But again, this is just me rambling about something. But to answer your question, anything human body related, and whatever you're interested in, you just please pick something that you actually like, not things that you think you should do because they look good, but something you're like, you know what, I could see myself learning about this for the next 4 years, or even a course, I could see myself enjoying this. Yeah, the more you know, the easier PA school will be, and the stronger your application will probably be in terms of the more you know about the human body.
Awesome. Somebody asked, can Canadian PAs work in the US and vice versa?
Canadian PAs cannot work in the US, but American PAs can work in Canada. Canadians are just so nice. We're just so overly polite that we allow American PAs to come and work here. But currently, American PAs do not recognize any of the Canadian accredited universities as what's the word? Legitimate, I guess. Not legitimate, but they just don't recognize the certification that we have right now. Another thing I will say about PAs in Canada is that because we're so new, we aren't actually a regulated profession. We don't have a protected title, and we aren't regulated, meaning that we don't have a college right now. And so we are working on that. We have bills that are in motion, and I think it'll happen very soon. But similarly to paramedics in Canada, paramedics don't have regulation either, but they still work and still function. PSW is the same thing, but they're kind of unionized. We haven't unionized. We are hoping to get regulated, and that's going to happen soon. So I think maybe once we get regulated, I think America may open up and allow us to come work there. I'd come over for a bit. Yeah, I'll work in California for a little while. I don't mind that. So that'd be nice. But right now, there are American PAs right now who are working in Canada, but there are no Canadian PAs working in America. you have to go to American PA school to work in America right now. So, but one day, fingers crossed, knock on wood, all that stuff.
It's interesting. I didn't realize it was so one-sided.
I know. You should talk to your people.
Yeah, I'll get them on the phone.
Yeah, thank you. Yeah, your people will contact my people.
Yeah. Somebody asked, what is a good way to prepare for, or how did you specifically prepare for PA school interviews?
Yeah, so in general, I think it depends on the school, like depends on what type of interviews they do. I think for general advice, what I would say, the best way to prepare for any interview is to, again, reflect on your life. Don't try to prepare answers as much as you should not prepare, but know who you are and know what you've done, know the accomplishments that you've achieved and the hardships that you've overcome. If you can reflect on all of those things, think about times you had difficulties, and things that you added to your life experience that make you a more suitable candidate. If you can go back and think about all of those things, and then, no matter what question comes your way, you'll be able to answer it because you can, go through the Rolodex of experiences and memories and use that as part of your answer. So that's one thing I would do, is start with that, reflecting. And then I do think you should practice. I think you should practice not reciting an answer, but practice speaking. Practice articulating your words and your thoughts in a organized, coherent manner, using not fancy words, but also not using incredibly informal words either. And sounding confident and not sounding robotic, not sounding unprofessional, but sounding like yourself, but like the best version of yourself. So I think practicing how you present yourself is huge, because people won't remember what you say, but they'll remember how you make them feel. I think it was like Maya Angelou or someone said that. So if you can show someone through interview that I'm someone you could trust with your healthcare, like you could envision me sitting, in an office talking to you about, your diabetes, then that makes them more likely to want to bring you into the school. So if you are not sure, if you're not sure of yourself, if you're not confident, if you are very scattered brained, or you're not organized, you stumble over your words a lot, then it doesn't make them feel confident in your ability. So then they won't favor or think that you're a good fit. So that's the second thing, I guess, is practicing talking. I talk a lot, as you can see, and so I've had a lot of practice. It's one of my favorite things to do, is just have conversations about difficult things, because you have to work your brain through it, and you can't just say, I don't know, and brush it off. You have to challenge yourself to try to articulate the weird abstract thoughts that you're having. And then practice with people, people who've done interviews before, people who are a PA, or people who are in the healthcare profession, friends, family. Get feedback from people. Don't take what they say and change everything, but take pieces of it and keep molding and structuring your answers. Record yourself and critique yourself as well. Like I did that all the time. I would just record myself, like I'm kind of right now. I would go back and I would watch this video and I would say, okay, how did I sound? How did I come across? Did this make sense? Were my points strong? Did I move my hands too much? Was I looking at the camera? Was I looking away? What was I doing? Critique yourself and be honest with yourself of how you did, and then get other people to also do it.
I think that's really good advice.
Sorry?
I said, I think that's really good advice.